Essential information regarding respiratory syncytial virus RSV. Point 1. What is RSV? RSV stands for respiratory syncytial virus. It is a common virus, identified and studied for a considerable time. The virus circulates year-round, but typically causes more illness during periods of high humidity, such as rainy or damp seasons. RSV causes respiratory tract infections across all age groups. However, children under 2 years of age are most susceptible to infection and at higher risk for severe disease. Compared to seasonal influenza, the overall severity of RSV may be considered lower in the general population, but it poses a significant concern for infants, young children, and those with underlying health conditions. RSV seasonality. In tropical and subtropical climate regions, such as Vietnam, the peak RSV season typically coincides with the annual rainy season. 3. Susceptibility to infection and reinfection. As previously mentioned, RSV can infect individuals of all ages. Nearly all children experience at least one RSV infection by the age of 2. Reinfection with RSV throughout life is very common, as immunity acquired from previous infections is not durable or lifelong. Modes of transmission. RSV is present in the respiratory secretions of infected individuals. There are 2 primary routes of transmission. Direct transmission occurs via respiratory droplets produced when an infected person coughs or sneezes, through direct contact such as kissing an infant, or via hands contaminated with respiratory secretions touching a susceptible individual. Indirect transmission occurs when an individual inhales airborne droplets containing the virus or touches contaminated surfaces fomites, for example, toys, tables, and subsequently touches their eyes, nose, or mouth. RSV can remain viable on environmental surfaces for several hours. 5. Incubation period. The time from viral exposure to the onset of symptoms incubation period averages approximately 6 days. However, exposure to the virus does not invariably result in illness. The development of disease depends on the individual's immune status and prior immunological experience at the time of exposure. High-risk groups for severe RSV disease. Certain pediatric groups are at increased risk for developing severe RSV disease and related complications, including infants under 6 months of age, especially those born at the beginning of the RSV season or attending daycare. Premature infants born before 35 weeks of gestation. Children with chronic lung disease, for example, bronchopulmonary dysplasia (BPD), cystic fibrosis (CF). Children with congenital heart disease (CHD). Immunocompromised children due to primary immunodeficiency, secondary causes like splenectomy or HIV infection. Children with Down syndrome trisomy 21. Children frequently exposed to tobacco smoke. Patients with persistent asthma. 7. Clinical manifestations of RSV infection. There are no pathognomonic clinical signs specific only to RSV that reliably differentiated from other respiratory viral infections based solely on clinical presentation. However, RSV is a leading cause of lower respiratory tract infections. LRT is in young children. Manifestations may include cough, wheezing, tachypnea, rapid breathing, increased work of breathing with respiratory muscle retractions, for example, subcostal, intercostal, apnea spales, particularly in neonates and premature infants. Long-term sequelae. Most RSV infections are self-limiting and typically do not result in long-term pulmonary sequelae. However, some studies suggest that severe RSV infection early in life may be associated with subsequent impaired lung function or an increased risk of recurrent wheezing and the development of asthma in some children. Necessity of RSV testing. In most clinical scenarios, diagnostic testing specifically for RSV is not necessary for routine management. RSV testing may be considered when the result could influence specific therapeutic or prophylactic decisions, such as the administration of palivizumab monoclonal antibody prophylaxis for very high-risk pediatric groups. Treatment for the majority of patients consists of supportive care. Inclusion and recommendations. RSV is a ubiquitous virus, with most individuals infected within the first few years of life. While some cases can be severe, the vast majority of patients recover fully with appropriate supportive care and monitoring. Undue parental anxiety should be avoided. Emphasis should be placed on implementing general preventive measures, which are effective against numerous respiratory pathogens, not just RSV. Key recommendations include avoiding kissing infants, especially neonates. Strict avoidance of tobacco smoke exposure for children. Practicing meticulous hand hygiene and regular cleaning of the child's environment and frequently touched objects, toys. Limiting the child's exposure to individuals exhibiting symptoms of respiratory illness. These simple measures represent the most effective parental actions to protect children's respiratory health.